They compare it to a dripping faucet at one point. Well, you can fix a dripping faucet. Use of the word annoyance repeatedly exploits American lay interpretation versus original in Pedersen et al., on which this review draws. The conclusions deny known and obvious link between annoyance and sleep deprivation leading to illness. And I believe this is inappropriate for a review that claims to be concerned with health effects. And how do I know that? Because Dr. Pedersen communicated with me last week, and this is what she told me. To be annoyed means a lowered well-being, and annoyance should therefore be avoided. We have indications from our field studies that wind turbine noise of high levels can disturb the sleep. Complementary experimental studies, however, needed to understand the physiological mechanisms. Patients don't go to their doctors and say, I'm annoyed. They say, doctor, I can't sleep. So this study indicates and repeatedly suggests that those who suffer are displaying personal or idiosyncratic reactions. The authors, of course, did no research. This white paper is not peer-reviewed. As the conclusions are contradicted by the material in the body of the document, it would fail as written. One of the major failings is that it doesn't recognize that this is a developing issue with developing science, does not acknowledge inconvenient, newer, or established known science and technology on the legalistic narrow grounds that wind turbines are not specifically mentioned. Dr. McCunney indicated that they put in the word wind turbine in their search. So this makes it very narrow. It means they can discard everything that was written prior to wind turbines coming onto the scene. And it's allegations of adverse health effects from wind turbines are as yet unproven. It's a strange word for a medical document, allegations. It's a legal term. And then they say that the findings are insufficient to advocate for funding further studies. This is what a decent health study would cost, $500,000. The installed turbine base is $35 billion in the US at a minimum. AWEA's document concludes that studies whose results might possibly affect the wind industry's business model should not be done. AWEA should be challenged to submit this document to a medical journal for peer review. The AWEA expert panel review is not a medical document. It appears to be a legal document designed for legal proceedings. How do we know that? Because they tell us. The objective of the panel was to provide an authoritative reference document for legislators, regulators, and anyone who wants to make sense of the conflicting information. And in fact, this document is showing up on the boards of planning boards all over the country as we speak. What do we know? Wind turbines put out most of their sound energy in the lower frequencies. New sound measuring equipment modalities show that known hearing thresholds are easily exceeded. Secondary vibration and rattle on residential structures convert infrasonic and low-frequency noise into more audible noise. Turbine noise occurs at 90 decibels. There's large variation in individuals. Many people hear turbine noise. It keeps them from falling asleep or wakes them up. They then suffer stress and sleep deprivation. The victims do not need behavioral therapy to learn to live with turbine noise. They need turbines placed far enough away from their homes. What does the future hold in store? Larger wind turbines, more sound. And tomorrow I'll be talking about the Deerfield Wind Project. Thank you.
Based on, as I said earlier in my presentation, I indicated that there are only 3 major epidemiology studies that have looked at people in the vicinity of wind turbines and potential health effects, and they're in Europe. But we did try to look at mechanisms of low-frequency sound and health effects and infrasound and health effects that have been studied in other settings and tried to apply that information to the issue of wind turbines. I don't know if that helps answer your question or not, but that's what we tried to do in the absence of direct studies. There's also, as I showed you, a number of unpublished studies that have actually measured sound levels in the vicinity of wind turbines and have actually measured frequency distributions in the vicinity of wind turbines. Now, there is a point that neither Dr. Nissenbaum nor I raised this evening that I think is worth saying, and that is, as noise levels are measured, there's usually the dBA scale. If you noticed up there when we put up sound levels, it was like 80 and then dB and A. A refers to the scale of how sound is measured. It's been shown that as the frequency gets lower and lower, the A weighting scale is not as effective. and you actually are better off using a C-weighted scale. And some of the studies didn't use C-weighted scales. So what's the practical implication of that? It means that if you use the A-weighted scale at low frequencies, you're probably underestimating noise by about 10 decibels. And that may account for some of the findings that you actually pointed out.
Thank you, Dr. McConaughey. I would say that that's exactly correct. I avoided going into A weighting, C weighting, G weighting, linear, etc. The A weighting, which you see in all these graphs comparing lawnmowers and grinders and so on, are really inapplicable. Well, one of the authors of the AWEA report, Jeff Leventhal, is on record as saying that when there is a greater than 20 decibel difference between A weighting and C weighting, the A weight, there's likely to be a low frequency problem. And in fact, what we find is that some of the lowest frequencies, the difference between A weighting and C weighting approaches 40 to 50 decibels. As regards the AWEA, the literature reviewed by AWEA, well, I'm certainly pleased to know that it wasn't limited strictly to wind turbines, but I would say in my review of it that it was a selective review, and it's not just my opinion. The National Health Service in the UK looked at this document and very heavily used to buttress the arguments in the AWEA report.
Second question. I think I'll just keep reversing it, or if it makes sense to go to one or the other, I'll just do that as it feels right. How do annoyance from sounds in urban areas, example subways, traffic, etc., compared with wind turbine sounds from low frequency to audible frequencies to infrasound? Dr. Nissenbaum, you want to take
Sure.
You want that? Huh?
Yeah. I referred earlier to the fact that we all sort of live or take part of an acoustic pizza, and in fact, that's what happens in the city. There's noise all over the place. What happens in rural environments is that the base sound level at night is very low, 20 to 25 decibels. So what we find is that in the case of Mars Hill, for example, the averaged over 1 hour, the average dBA level is 49 in terms of the graph I showed you, and it's actually been measured by the main DEP at 52.5. So what we respond to is differences over the background. As humans, this is how our brain works. We sort of have a thermostat that we set, and we respond to differences over that baseline. In rural environments, the difference of a wind turbine superimposed on a rural environment is striking, whereas in a city, it may be less so. There are other qualitative effects of wind turbines, but that's sort of a rough explanation.
Nothing more?
No.
Okay. What is the recommended setback for a mountaintop turbine from a residence? A quarter mile too close, half mile too close? What about multiple turbines within half a mile of a residence?
Clearly, this is a question of great interest to a lot of people, including myself. Frankly, in my view, I'm not so sure that one can recommend a strict distance from wind turbines. In my view, it's probably better to set it based on the noise level. Therefore, if there's one wind turbine, you may be able to be closer to residences. If there are many turbines, and certainly turbines of higher output, you may need to separate them much farther from residences. So I would suggest that rather than any definite setback, that decisions made on proximity of wind turbines to residences be made based on noise levels.
I think in a perfect world, basing them on noise levels is exactly the way to go. That presupposes that the pre-construction sound modeling is accurate. And that's critical, because after these things go up, they're not coming down. So, and what we've learned in Maine is that the pre-construction sound modeling is faulty, at least as it was used in the Maine projects. It failed to take a linear arrangement of wind turbines into account. The window during that was used was the DEP allowed them to get by with averaging the sound over, I believe it was 5 seconds instead of a quarter second, so the pulses were not captured. There were no allowances made for icing conditions. So based on my experience in Mars Hill, where people are suffering out to 3,500 feet for a ridgeline arrangement is clearly no good if you are downwind of those turbines.